Hi guys, today's NCLEX question answering strategy focuses on prioritization and the ABCs, airway, breathing, circulation, which is essential for selecting the best response in clinical scenarios, right? So if you have any clinical scenarios, um, today's strategy is going to help you out, right? Understanding prioritization help you identify the most immediate or critical needs, which often dictate the correct answer. So, one, you need to understand the ABC framework, right? The NCLEX frequently uses clinical scenario where multiple action or nursing intervention could be appropriate to determine which intervention to prioritize. Think in terms of ABCs, right? Airway, breathing, circulation. Airway, if the patient airway is compromised, right? This is the highest priority. A patient can't survive without a clear airway. Breathing, once the airway is open, assess and address any breathing issue. Respiratory function is vital, right? Circulation, after airway breathing are established, circulation become the next focus. Issues with blood flow such as shock or severe bleeding are also prioritized. Good. Let's answer this question, right? We have a patient present with labored breathing, rapid pulse, and low blood pressure. Which of the following actions should the nurse take first? Anytime you have a scenario that have to do with different finding, what you come to mind is your ABC, because trust me, we want to attend to every of that abnormal finding, but we need to do it in a, let me say, systematic manner or approach, right? We need to do it in a form that we answer it by asking ourselves which of these finding is the most important right now for us to solve before we jump to the other ones. We have labored breathing, rapid pulse, low blood pressure. And how do we know? That is the reason why you have the ABC. You understand? Because if you look at it right here, let us see administering fluid for blood pressure. Yes, that's going to solve the low blood pressure. Position the patient for optimal breathing. Yes, that's going to solve the labored breathing. Begin CPR. I don't really see this patient as a patient that needs CPR. But if we don't intervene to this patient can end up being pulseless and then would need CPR. But right now they don't need CPR. Check the blood glucose level. I don't see the patient as someone that that need blood glucose being checked. So let us say we are taking off begin CPR and check the blood glucose. Right now you can see administering fluid, positioning the patient can solve two things right here. But we need just one correct answer. So how do we identify the most appropriate answer? That is when we apply the ABC. And what does the ABC ask us to address first? Airway, breathing, circulation. And we can see this patient has labored breathing. So what intervention best match labored breathing? That is positioning the patient for optimal breathing. And that is the correct answer, right? So next is the Maslow hierarchy of need. A lot of the time is that I see students trying to like fit in different strategy into one question. One, you need to understand the question, right? If you understand the question, then you can know how to fit in what specific strategy you will be using. You can only have different finding and use the ABC to fit in. And sometimes you can use Maslow hierarchy. But question that maybe you might use Maslow hierarchy for might be question that have to determine, are you going to decide to attend to physiological needs now over safety, social, esteem, self-actualization need? right? Because on the NCLEX, physiological issues like breathing, hydration, elimination are typically prioritized over emotional and psychological needs, right? Let's answer a question. Now, we have a patient with chronic pain. They are requesting a stronger pain medication. Let us say, based on this, our understanding, we guess that they have gotten a particular medication. Maybe they feel it's not really working for them. So now they need a stronger pain medication. So now you as the nurse observe that their respiration is low and shallow. Now, what would you do? It's just like right now, you have someone that is very hungry, but they have difficulty swallowing. We cannot say because they are hungry so bad, we should feed them so bad. They have something that is causing a limitation in us feeding them. So right here, even if the patient is requesting for a stronger pain medication, this patient still have something that might not likely make us give them the medication. Let us, it's like we don't know what is going on right here. For people that can critically think, would have been saying, oh, maybe it's the pain medication that is causing the respiratory, so. But this is normal understanding. You have a patient with chronic pain requesting a stronger pain medication, but look at that keyword, but that but is trying to tell us that we are trying to like think that we don't want to give them a stronger pain medication because they have this kind of condition right now. So even if you don't know that some certain pain medication can cause respiratory issues, understanding the question can tell you, yes, since the pain medication is causing that. Now, understanding that the question is asking you, what should you do? You understand? So we know they need pain medication. How we really want them to have that pain medication so bad so that they cannot have chronic pain. But I'm so sorry, we can't give it to you because you have respiratory issues. You understand? So that's what Maslow hierarchy make you do. Make you see what is more important than others, despite everything remain important. Right? So now I'm looking for option that will not make me to give the medication yet because they have respiratory issue. Is either I'm looking for answer choice that is not making me to give the medication yet, or I'm looking for answer choice that is making me to more evaluate that respiratory issue. Now, let us look at the option. Provide the requested medication. That is not what I'm looking for. Check respiratory status and hold the medication if needed. Yes, that is what I'm looking for. Encourage the patient to relax. That is not what I'm looking for. Contact the provider about alternate treatment. That is not what I'm looking for. Provide the requested medication. I have a bot right here. So I'm not going to provide the requested medication because I have a bot. Check the respiratory status and hold the medication if needed. Yes, this is what I'm looking for. Encourage the patient to relax. Don't patient has chronic pain. How do you expect the patient to relax? They can only relax when there's no more chronic pain. So that is out of the picture. The first option is out of the picture. The third option is out of the picture. Contact the provider about alternate treatment. Why do I serve as the nurse? To know this patient has respiration being low and shallow, and I just want to just go straight to the provider and tell them they should give alternate treatment. Why am I not telling the doctor that due to the pain medication, they have developed respiratory issues, and what should we do about it? Why am I just directly going to tell the doctor they should give alternative treatment? So what will happen to the respiration being low and shallow? What are we going to do about it? Right? So, which make you come back and say, yes, checking the respiratory status and hold the medication if needed is important. Right? So, B is the correct answer right here. Now, we have the nursing process. Practice the nursing process. Many of the English questions are written in form of the nursing process. That's why I tell a lot of students, any question you are seeing assessment, 80% of the time, that is the correct answer. There are questions that because of you need life-saving intervention, you will not do assessment. You understand? There are questions like that. If you are part of my program, my course, there's a particular point we cover life-saving intervention. Those intervention you have to do it without assessment. Questions like that shows up on the NCLEX exam, right? But you can see right here, the nursing process is assessment, diagnosis, planning, implementation, evaluation. But the NCLEX don't use diagnosis. The NCLEX use um the NCLEX use planning, but it's more together planning implementation. The NCLEX use evaluation, but the NCLEX don't use diagnosis in your standalone question. Instead, the NCLEX more use that when it happened to be your case study, right? But it's more of the AIE, assessment, implementation, evaluation, right? So now, if the question is telling you to assess, the answer is that assessment answer has 80% chance of being the correct answer. Yes, I'm telling you that it has because the exam they put according to the test plan, the NCLEX test plan, most of the questions are written in form of the nursing process. To identify what you are going to do first, you need to do assessment. It's very important. Assessment is key because the assessment will open ground for the right planning, the right implementation, and you will be able to evaluate rightly. You understand? So, assessment. If I'm not missing anything, let's proceed. Now we have a patient post-surgery. Most of the time, a lot of students don't read the question word for word. This question is not talking about only surgeries, indicating the point at which you are in the surgery. Post-surgery, report mild. That's another keyword to notice. Mild shortness of breath. Some people might report severe shortness of breath, moderate shortness of breath, but this is mild. You understand? What should the nurse do first? I tell students, monitoring, if you see, monitor the oxygen saturation. That monitoring the oxygen saturation can be a form of assessment, but it's an assessment evaluation. That is not an assessment that lead you to how do I say it? Monitoring is like you don't want to intervene, you just want to find problem, right? You just want to identify a problem at that moment. You are not really thinking of intervention. You are more thinking of making the patient still remain in the positive side than coming to the negative side. But checking oxygen saturation, we are checking in the form that we have this kind of mindset that it might be good, it might be bad, the result. You understand what I'm trying to say? So the keyword matters. Check, monitor. Monitor is evaluation. Check is assessment. You understand? So it's not until the NCLEX write assess oxygen saturation before you know that is assessment. You get what I'm trying to say? Because that is what make a lot of students get below the passing standard when it comes to evaluation because they don't know the how to evaluate based on maybe the wording of the options or something. I don't know. So right here, what should the nurse do first? Even if you don't know I'm testing you on for this question, even if you don't know I'm testing the nursing process, let us just read the question like we don't know is the nursing process. We have a patient post-surgery report mild shortness of breath. The question is somebody after surgery, not that they have had problem breathing before they started the surgery, but post-surgery they started reporting mild shortness of breath. Don't you think I would like to find out what is going on? I would like to find out what is going on. Now, this is how you answer questions like this. If I elevate the edge of the bed, that is the only thing I have to do. And I'm going to skip the question or move to the next question. Now, if the NCLEX now have this kind of, how would I say, let's say maybe the NCLEX has this kind of way of coming back to tell you that, oh, Mr. John Doe, you selected elevating the head of the bed, but the patient oxygen was low. The patient later died. How would you feel about your answer? So that is how I make students really critically think. If you should only do one thing and then move to the next patient, hoping that what you've done for that patient will keep that patient safe or will lead to further intervention, what would you do? If I elevate the head of the bed, I'm just elevating the head of the bed, I'm going to the next patient. I don't know what is going on with the patient internally. If I administer oxygen, okay, I administer oxygen. I don't know if this patient is a kind of patient that might be contraindicated for too much oxygen. If I check the oxygen saturation, we know if elevation of the head of the bed is important or administer oxygen is important. That is what we call umbrella. Now, notify the physician. As the nurse, you need to do something before you notify the physician, except if that condition have to do with a surgical or medical assessment. Let me just say it like that. What we are dealing with right here is something a nurse can handle, mild shortness of breath. Though it might be a result of the surgery, which the doctor have to handle that. But right now, what we are dealing with is not the surgical issue. Instead, we are dealing with maybe a sign and symptom uh that the patient is starting to feel after the surgery, which is shortness of breath. And we can check the oxygen saturation. And one of the reasons why we are not even jumping to administer oxygen or elevating the head of the bed, we don't know the kind of surgery. Okay, let us say it's a hip replacement surgery. Are we going to elevate the head of the bed? You understand? So, what of if, based on the patient condition, maybe a patient that has COPD, they did surgery for that particular patient, mild shortness of breath, without me not knowing the oxygen saturation, we know they need to be between 88 to 92. Do you think I am going to administer oxygen without not knowing the oxygen saturation, whereby I understand that patients with COPD, they lose their drive to breathe if they have excessive oxygen? This is where you critically think. And now tell yourself it's important to be safe by knowing the oxygen saturation. Then I cannot think about the next step to take. And all this critical thinking, I did it without not using the assessment, diagnosis, planning, intervention, evaluation. But I'm just giving you the strategy right there in case you want to use the strategy, right? So if you want to learn more on how to critically think, analyze questions, join my program. You are definitely going to be well prepared to answer any NCLEX question, even if you don't know the answer. Even if you don't understand even what is in the question, it's better to understand the question. You understand? It's just like right now, somebody tell you, "I want to travel to London." You might know they need to travel to London by air, but you might not know how they can book the ticket to travel to London. It's okay not to know how, but you definitely know they will travel by air based on where they are, the location they are, and something like that. So what I'm trying to say is that every question, there's a particular understanding that you will be able to create from every question, even if you don't know how to arrive at the answer or you don't understand the condition, but you will understand the interpretation of that question. But the knowledge might be the one lacking. But how do you turn that new knowledge to the best possible answer? That is what I'm going to put you through if you join my course. It's not only that I don't my course, but that is one main thing because you might be challenged with questions you don't know, right? On the NCLEX exam. So let's move on to safety and risk reduction, right? Prioritizing action to reduce risk or improving patient safety. If a question presents potential complication or risk situation, high risk situation, look for options that provide the safest approach or prevent worsening of the condition. It's very simple, like it's very simple as that. Right now, we have a patient with asthma um who is wandering the hall at night, what should the nurse do first? Anytime you have the question, what should the nurse do first, always think about assessment. You understand? Always think about assessment or option that solve that problem. But if you look at the assessment and it makes sense, good, just go for it. You understand? One thing about safety is that a patient with asthma that is wondering, do you know there might be a voice that is telling them that they should wonder about. So in this question, we don't just want to escort the patient back to their room, because if we escort them back to their room, we think we've done a great job. But what if the voice is telling them that, listening to the nurse, just go back to your room. When the nurse has gone, I'm going to take you in a different direction. You understand? So you need to assess the patient's reason for wandering about. Providing a sedative, we don't want to do that. Sedation, restraint, those are the last thing we want to do. Contact the family member. Obviously, you have the patient is in your care. They brought the patient to your care because they know you are best in handling that particular care. The hospital is best in handling that particular care. Why do you want to contact the family member? Is it beyond the nursing control? No. We want to escort them back to their room, but we want to know the reason why they are wondering about. They might be hearing voices that's telling them, go here, go that, go this place. You understand? They might be hearing voice. So we want to confirm what is really going on, right? So assess, right? Because this align with both safety, sorry, it align with both safety and the nursing process. And it will help us to prevent risk associated with wandering. Use least invasive use least invasive first approach, right? I guess that speak a lot for itself, right? Let's go to the question straight. A patient reports abdominal discomfort after surgery. What should the nurse do first? You understand? Anytime I'm saying uh invasive, you understand? And I see two invasive options, right? I look at the non-invasive option. If that non-invasive option don't look like a routine, I'm going to select that answer. Routine means that it's something they can do after you've done the necessary intervention. They can keep on doing that to make sure they stay more healthy and stuff like that. So now, encouraging deep breathing and repositioning, will it help that discomfort that they are having right now? Yes. And what are we talking about? Surgery. Surgery is not what the discomfort they are facing from surgery is not what they will face every day. So I can easily tell them to do deep breathing and repositioning, because that's going to help them at the moment. You understand? So administering pain medication as prescribed, that is invasive. Insert an NG tube as ordered, that is invasive. Call for a surgical consult. No, we can easily tell them they should debride and reposition, if that could help. If that is not helping, right, then we can now think about more intervention to be done, right? But the truth is that many of the time, right, you just need to look at the least invasive approach and ask yourself, what are we dealing with? It's just like right now, if we are dealing with hypertension, the least invasive approach might not be the correct answer, because the least invasive approach might be a routine, and we don't do routine first. We do intervention first before routine. You understand? But this is a surgical issue. So a surgical issue is not going to last all their life. So we can easily do the least invasive approach that can help the patient right now. You understand? Before the more invasive approach, right? So yeah, that's the correct answer. C. To summarize everything I have said in this short lecture, One, prioritize using ABC, address airway, breathing, circulation need first. Two, use Maslow hierarchy, prioritize physiological need above other consideration. Three, apply your ADPIE nursing process. Start with assessment, then plan, implement, and evaluate. Four, safety and risk reduction. Choose action that reduce harm or prevent complication. Five, least invasive force. Whenever possible, opt for less uh, invasive intervention. The truth is that if you follow this strategy, you don't expect to get 100% in any of your practice question. One thing I say about students is that the moment they start using the strategy and it fails, they stop using the strategy. They start looking for more strategy. The truth is that there's no strategy that can give you 100%, but I can guarantee you that this strategy will give you 80%, which I can also guarantee you that if you follow this strategy, it's definitely going to make you have to pass your NCLEX exam in 85 questions. So it's nothing to be worried about, even if you use the strategy and you fail a particular question. If you use it right, does not mean you cannot fail a particular question, because we have some certain questions that don't follow this exact process. There are some questions that need immediate intervention, that don't need to follow the right process. They need immediate intervention. You understand? So that's why I can guarantee you that the questions on your NCLEX exam that will need immediate intervention are like 20%. The one that's going to follow this strategy are like 80%. So if you follow this through without not seeing yourself failing some question and you are worried if the strategy is working, trust me, you are going to do just well. But if you join my course, guess what? You are going to get those questions, those 20% questions that need immediate intervention, that you will be able to like carry out the necessary thing to do. You understand? Then you need to carry out the necessary thing to do, because you will get familiar with those type of questions. So if you need help with your NCLEX studies, DM me on Instagram at future_RNPN, right? Just go on Instagram and look for future_RN_PN. You understand? And then add me up, message me, and I'm going to help you out with your studies, right? So I will see you in my DM. Bye.